So I think the more you expose yourself to things, you realize what is your calling and what is not. And that was my approach throughout my law school journey.
Hello and welcome back to another engaging episode of the SuperLawyer YouTube channel. Today, we are honored to welcome Kashish Aneja, sir. Sir is an advocate and international legal consultant specializing in global health law, policy, and governance. He has recently served as a visiting scholar at Harvard Law School and is consultant at the O'Neill Institute for National and Global Health Law. He also advises the Government of India as well as international organizations, including the WHO, CEPI, Gavi, and UN agencies on various health law and policy issues. He is also the co-founder of Society for Democratic Rights, New Delhi, fostering legal dialogue between India and the US. We are delighted to have you with us today, sir. My name is Anshi. I work as an associate with the SuperLawyer team. At SuperLawyer, we showcase inspiring journeys of legal professionals offering valuable insights that greatly motivate and benefit our readers, which are young lawyers and the legal community at large. Thank you for being with us today, sir. I request Divya ma'am to now please continue with the conversation.
Thanks, Anshi. Thanks a lot.
Hello and welcome, everyone. Thank you, Kashish, for being here. It's a sheer pleasure, and I really hope that you will enjoy the conversation. I'm Divya Dwivedi. I'm team lead at SuperLawyers. And I enjoy taking these kind of interviews because the lawyers who are practicing in international law are in a very different niche field. And you being one of the very rarest field, global health laws, I hope that our learners will understand and see how you have built your way towards international community, and also to understand why understanding of health laws is absolutely important and of paramount importance anywhere in India or worldwide. Thank you for agreeing to be with us. Most welcome to our SuperLawyer episode. Hope you will give us the insights and our learners will learn from you and your journey. Thanks for being here.
Thank you so much, Divya. It's a pleasure. Thank you.
So let me start with the very, very initial and very common question, I'm pretty sure, that has been always asked to you. How and what was the inspiration behind you choosing law and then moving ahead and choosing global health law and making your way towards international community and making a name for yourself and for our country? Please do let us know.
Sure, Divya. Okay, so that would require me to go back almost 15, 17 years. I think the choice for picking up law as a degree right out of my schooling was an amalgamation of different influences, something starting right from home, to the extent that I don't come from a family of lawyers. I'm a first generation lawyer, but I come from a family of doctors. And the fact that I've been born and brought up seeing my parents and my brother dealing with the society directly and trying to solve their problems. They did that through the means of medicine. I found out that my means of doing it is law. And I just didn't want something which would require me to only sit behind the desk, but I wanted something which would require me to understand societal problems and then help solve them directly. So that was the core inspiration behind the idea of why I want to pursue law. But then it was also about me examining some of my interests and skill sets. I did my schooling from St. Columba School in Delhi. I was into debating. I love public speaking. I realized I have a decent amount of analytical and logical aptitude. So bringing all of that together, I felt that law is a great way to be out there as well as to exercise my public speaking skills. And then overall, as a personality back then and even now, I have a very, I would say, dynamic personality. I like to put myself into complicated dynamic situations. I like working on multiple complex issues at the same point in time. During my 11th and 12th standard, I examined a lot of different professionals, lawyers, chartered accountants, doctors, just to understand their lifestyles and which ones were more appealing to me. And at that point in time, I decided that law might be my calling. Although I must confess, it wasn't until the end of the first year of law school I was sure that I was doing the right thing. But after the first year, I realized I was home and I felt like this is something I really want to pursue. So that was broadly the story of partly being deliberate about it, partly taking a conscious decision, but the rest being luck and fate that I ended up in law. And then the story about global health law is That's a very different one. That's again, to an extent, an amalgamation of partly making conscious, deliberate decisions, but then again, fate coming along the way. As I mentioned, I come from a family of doctors. Since my childhood, the dining table conversation has been about the healthcare industry, has been about the healthcare infrastructure. It has been about the issues doctors are facing. It has been about issues hospitals, healthcare institutions are facing, issues about the basic access to medicines, healthcare, as far as the common people are concerned. And then me realizing that the problems are not limited to India, the same problems are there across the world, irrespective of the kind of economy we are living in. And that's something I realized during my childhood, adolescence, and then throughout my entire law school journey. And so that's the problem I had identified. I've always had a problem solving mindset that led me to find solutions to the problem, and law was a perfect tool to find that solution to this huge problem of lack of adequate infrastructure. But then there were a lot more factors. I exposed myself to some relevant areas during my internships. I interned with senior advocate Indu Malhotra, who later became Justice Indu Malhotra. I did some internships with NGOs, which were focused on public health issues. On a separate issue, I tried to diversify my internship in every possible field during my 5 years of law school to give me the right exposure. And I realized that whenever it was anything to do with the intersection of law and health as a subject, that really interested me and that really inspired me. So the exposure, the problem solving issue, all of that came together. And then I would say I had the right mentors in the process as well. Both Justice A.K. Sikri, whom I clerked with, who was nearly my first boss in my professional career, as well as Justice Indu Malhotra. Both of them were highly influential in me taking up the specialization in health law, doing the LLM in health law. And it was not an easy decision back then because pre-COVID and post-COVID health law has been very different. Now it's become an obvious specialization, right? We're seeing so many students and so many lawyers understanding the importance of health law and being interested in pursuing health law. Pre-COVID, that was not the scenario. And I entered into the entire specialization pre-COVID, which was quite a high risk, I would say, because a lot of the lawyers, and I won't name some, but like a lot of senior lawyers had advised me against taking this specialization. But as I mentioned, I had both Justice Sikri and Justice Malhotra who were like highly instrumental in asking me to take that risk. And I think I needed that push to be sure about if I'm doing the right thing. Back then, my understanding of health law was also very limited, of course, which is the common parlance in India, even right now. People often correlate health law to mean only healthcare law or to mean just medical negligence. But that is just one speck of the entire world of health law and policy. And so a lot of my understanding of health law was formulated during my clerkship period with Justice Sikri, while I worked on the euthanasia case in that year, while I prepared my SOPs, while I looked for the right institutions. And that led me to the process of realizing that I wanted to do a global health law LLM.
So as you said that you are from family of doctors and first generation lawyer. In the very first year of your law, you understood that what you wanted to do and this was the right path. Your internships are also very, very unusual. And you have kept on choosing certain fields, especially global health law, which is absolutely different. And it has become more important now, as you said, after COVID. But when you decided on doing LLM, on going ahead with the variety of masters from Geneva Graduate Institute, followed by Georgetown University Law Center, how was all this internships, your learning, your practice instrumental in deciding where you have to go? Because these institutions are also very, very, I would say, top notch, kind of Ivy Leagues in their own field, if you talk about global health laws, especially involving international laws and policy making. So, how did you end up deciding on pursuing these? And how did you make sure that you get into those fields, those institutions per se? Because entering those halls are also a very big deal. So I would request you to share some insights about the kind of challenges, about the strategies that you built for the learners so that they can also try and understand how you have formulated your way through conscious and subconscious decisions that you have taken over time.
So I think in anyone's journey, it's important to understand who you are and what you like and what you don't. So as I mentioned, I am a dynamic personality. I like working on complex issues. I like to solve problems. That was a problem I identified in terms of healthcare. Then as a personality, I like working on very niche areas. I like working on emerging issues rather than issues which are already well established or issues where we already have a lot of people working on them. And that's a personality I execute even till day. I only take up projects and clients where I feel there's a niche or which solves complex problems. And that was something I identified during my law school journey, during my internships as well. And that's why I didn't want to do, so to say, regular internships. But at the same point in time, my idea of internships and approach towards internships during the 5 years was I interned at every possible opportunity I got first. And second, every internship was different from the last one I did. I did not repeat any kind of internship. By that, I mean, I didn't even repeat the industry I interned it or the subject matter or the forum I interned. In terms of litigations, I interned from district, high court, Supreme Court. I did all different kinds of internships. I interned with senior advocates, with judges. I interned with AORs. I interned in-house counsel teams. I interned at law firms. That's when I realized law firm is not my thing. So I think the more you expose yourself to things, you realize what is your calling and what is not. And that was my approach throughout my law school journey. And then once I was sure, as I said, during the entire process of why global health law, another most important decision was which institution I would want to pursue it with. And that was not an easy one, but it was not a difficult one when it comes to health law. The specialization of health law has been very niche, and especially pre-COVID, I would say it was much more niche than now. And if you look at Georgetown, they are one of the finest specialized institution offering the right number of health law institutions. They have almost 50 health law and policy courses, which you would not find anywhere else. So it gives you an opportunity to actually curate stuff howsoever you want. And then the O'Neill Institute, which is one of the centers at Georgetown, which sits at Georgetown, is an organization specializing in health law and policy. They are the WHO's collaborating center for health law and policy. I'll explain what that means. So WHO has different collaborating centers, which are specialized institutions across the world. They have only one specialized collaborating center on health law and policy, which is the O'Neill Institute. So because of that designation itself, and because of the rich history that the O'Neill Institute enjoys, there's a lot of exposure you would get during your LLM at the Georgetown University. So that's how I decided about doing this LLM. And that's how I ended up at the Georgetown University. And I always talk to students when they're applying, and I usually grill them on this one question of why you want to do an LLM. I think it's become more of a fashion these days that people want to do an LLM from abroad. And often people don't have a why of doing it or like what's their plan of action. I mean, you don't need to have everything planned out, but you need to have something in mind. It's a huge investment, time, energy. So I had my why very clearly defined. Although I didn't know what I'm going to do after that. My plan was always to come back to litigation because litigation has been my first love. But clearly life had different plans for me. But Georgetown was an obvious choice. I was grateful to get into it. I also got awarded a scholarship that made my decision a bit easier. I also wanted to opt for a US university rather than a European university or an Asian university because of, again, the US universities are much more dynamic in nature. I thrive in dynamic environments, and hence it made sense for me to be in a more dynamic institution rather than a more traditionally academic institution, such as in the UK. So Georgetown wasn't a hard decision. What was a harder one was the specific LLM I did, which was I did a joint LLM between the Georgetown University and the Graduate Institute in Geneva, which was the harder decision, I would say, because switching between countries and institutions and continents for different semesters in your master's is not an easy job. And very few people opt to do that. It's difficult because you have only a fixed number of months left in both the institutions, which you have to make the best of. And like academic environment in India versus the US versus Geneva is very different. You have to get used to that. You have to get used to the infrastructure. There's a lot which takes, apart from the fact that you have to physically move cities and settle yourself in a fresh city and a fresh continent. So it was a very deliberate decision I had to take. I was not sure up until the last moment. But I'll tell you what factors I took into account when I decided to do this joint master's between Georgetown and the Graduate Institute. First was, again, I thrive in dynamic environments. I felt this was a dynamic environment itself with the amount of complexities that was being created. Second, I felt and I knew that I wanted to have a career in global health law rather than just domestic and national health law, Geneva is the hub of international relations as well as global issues, given the entire UN and WHO is based in Geneva. And that ended up me in taking the call of why I wanted to take a graduate institute as an option, along with the Georgetown University, and both offered very different environments. So that's been my journey of why global health law, what influenced my decisions, and then why I ended up with these institutions.
You very specifically said that your why was very clear. So how did you come up to that particular why, and how did you make it so clear for yourself? If you could shed some light on trying to understand, because like you said, no two internships were the same. You always had a different dynamic view of living your legal career. You love litigation. But how did you collaborate everything? Understand this? Because most of the time, usually in universities and colleges in India, it is so told that stick to one subject or one kind of thing so that you can excel in that particular field. But what you are showing is absolutely different. You interned in as many fields as possible, but yet ended up in one of the top-notch institutes in the world. You also are collaborating with Harvard Law School, and there are so many different facets to your life. How have you managed to do that with this much dynamism in life, in the way you study? And I'm absolutely mind blown that I want to understand how you have managed to do that. And I'm pretty sure that learners also would like to understand.
So I don't come from a national law school. One of the benefits of not coming from a national law school is that you are not told what to do. And since I was never told what to do in the law school, and a law school, I mean, like I come from IP University, Dwarka, right? And the fact that I was in Delhi and the fact that I was not told what to do, it meant that I could decide what I wanted to do. And once you have that decision more independently, I wanted to carve out my own niche. I wanted to carve out my own journey, and I wanted to take very deliberate decisions about that. And I think that's what I did. To an extent, I did leave a lot to fate and luck, but I would say the majority of the things, I had my principles in life and my ethos in life very straight marked up. And I constantly drew towards, I would say, what I was really passionate about, what I really enjoyed doing. I often left things which I didn't enjoy doing. That's it. All of this comes with the level of privilege and luxury. I absolutely understand that. But I was always of the mindset, if I'm not enjoying doing something, I would not do it. And that led me into things that I enjoy doing. And today I really love what I do every single day of it. So that was more of my understanding throughout my law school. That's more what went into my mind during that entire journey. And then, of course, having the right mentors in the entire process who would help you, maybe not give you the right answers, but help you guide in a particular direction. And just being meaningful and just being mindful about the time you're spending and your overall journey. I would say all of those factors. I wish there was a formula, there isn't, but I think it's more about just being a bit more mindful about your choices and having an open mindset as things come on a way.
Wow. Being mindful is absolutely, I think, the key. Keeping all this together and entering into being an independent legal consultant, you have also been contributing to a variety of policies in developing and developed countries, alongside working on national legislations for countries, especially in Asia Pacific region. You also work with the O'Neill Institute. How have you understood these policies in a sense that there is a difference between the kind of culture that we work in, the kind of demography that we are in, the way developed countries think or their policies work? They may not work in Asia Pacific region, specifically in India. So how do you find that particular balance? What kind of thought process goes into while you're planning these policies? Because these policies are going to affect not only certain amount of people, but whole of the country per se, if you're working there. So what kind of thought process is there? What kind of mindfulness do you look forward to? How do you plan it? What kind of research gets into it? And if a learner or a person wants to enter such kind of a field where it is absolutely research oriented field, what should be there in their pathway to plan the kind of learnings they should do, the kind of readings they should do, understandings, and how do you see that it will affect the society? because your parents, your family, you already have seen how they serve the society. So how do you see your policies serve the society? We would request you to shed some light on that as well.
That's a very interesting question, and you're really digging in there. But okay, so I would first broadly say that it's very different working in a domestic space and an international space, to the extent that, especially those who've worked in economic space, I would say that working in a domestic law perspective is very micro in nature, and working in international space is like macroeconomics. To the extent that when you're working internationally, and that's been, I would say, my broader focus, you have to understand how governance work. You have to understand what different stakeholders are there. You have to understand how different stakeholders work. And you are dealing with very different kind of stakeholders. You're dealing with governments, you're dealing with different ministries in governments, finance, trade, health. You are dealing with international organization institutions like the UN. You are dealing with non-profit organizations, domestic, international, NGOs and CSOs. You're dealing with universities. You are dealing with institutions and policy think tanks. You're dealing with another category of PPPs, public-private partnerships, which are amalgamations of the public and private sector. You're dealing with foundations like the Gates Foundation, Bloomberg and all. Each of these players comes with a different set of expectation, different kind of understanding, and you need to specialize in understanding their expectations. You need to specialize in understanding their mindsets. You need to be able to speak in their languages in the entire process. And that's what working in the international space requires and demands. A lot of what I do also involves a lot of this, and then translating the international policies into the domestic context. That requires you to understand the domestic context very clearly. The individual principles of a country, the different contextual problems each country has. It would have been a very easy world if you were just copy pasting what's happening at the global level in a domestic level in 194 countries or like 196 countries. But that's not exactly how things work. I've been involved in drafting policies and legislations for a lot of countries, especially in Asia as well as Africa. And you really need to understand the domestic context in domestic countries. And same point in time, it's important to understand your, as an individual's expertise limitations. You need to understand where your limitations end and when you need to prioritize giving space for another expertise, which would have more relevant domestic context. Which leads me to an important point of like international space is collaboration. And the spirit of working collaboratively is much, much more in the international space than I would say in the domestic space. And that's something which also slows down the process, but that's something which results in a much more deliberate, comprehensive result, be it the law being defined or a particular problem being solved. And so all of that comes together in the context of differentiating the international practice and the international law practice versus the domestic practice. And you said what someone can keep in mind in doing so as a student and once they're going forward with this. I think as a student and as a young professional, which I've also always tried, is having strong foundations and having strong base. And obviously, our foundations start from the domestic level. It's great to start learning and understanding international law from a law school, but it's also equally advantageous to understand your domestic context and your domestic specialization in doing so. And then also making sure that your relevant skill set as a lawyer is honed in the process. So all of that would come together in this sense.
While you were talking about this, I really was thinking about the kind of impact that we see today through technology, because everyone talks about it. And as you were saying, pre and post COVID have been different worlds, obviously, for everyone. Same as for global health laws as well. While you were working at Harvard, your work is more focused towards technology transfer agreements and the kind of pandemic agreements that you made for WHOs. What kind of involvement have you seen of intellectual properties, artificial intelligence, and different variety of technologies that are actually impacting our lives in daily basis? Also, they are so dynamic and they are so different. What do you see in future when you are talking about technology transfer in between not only universities or researchers, but in between countries? And how are those policies going to impact day-to-day life of the residents of those countries? Because all of this comes under international law, and that's your forte. We would love to ask you about these impacts also, because as per my understanding, a health field is most impacted by AI or robotics or the kind of technologies that are getting developed every day. And they are trying to make it more human friendly and more impactful for human lives to be extended. So, how do you see that in today's world?
Okay, a lot of different topics you touched in that particular question. But since you also mentioned Harvard, I would just spend a minute sharing what I was doing over there because it also directly corresponds to tech transfers issue. So I spent a lot of my time over the last 6 months at the Harvard Law School, primarily spending my energy and time into two things. First was in my core substantive area of access to medical countermeasures, which is access to medicines and vaccines and health products, and doing that in the sense of how technology transfer facilitates access to medical countermeasures. What are the legal hurdles in doing so? What would be the incentives for more smoother tech transfers from high income countries to low income countries to facilitate increased access to medical countermeasures? That area of my research and interest stemmed through the pandemic agreement negotiations that recently concluded at the WHO. And I've closely followed and worked and advised on those issues over the last 3 years. So tech transfer emerged as one of the core contentious issues in the WHO pandemic agreement negotiations. And I wanted to go much more deep into those issues. So that's what I did over the last 6 months at Harvard. It involved extensive research, having discussions with the faculty, conducting semi-structured interviews with the huge health infrastructure we have in Boston, including the people at the law firms advising on tech transfers, and then delivering talks and lectures both at Harvard and across the US on these issues. The second area I spent a lot of time was on international negotiations. Since I didn't get a chance to have an official training on international negotiations during my LLM, because there's always a trade-off when you're choosing courses. So I wanted to spend time in international negotiations at Harvard, and Harvard's negotiation trainings are considered to be one of the prime ones. So I spent a lot of time doing mock trainings on international negotiations. A lot of them focused on health. And that was a very interesting experience, especially sharing all those times with the Harvard JD students. I think the last 6 months were a good mix of my technical expertise in terms of, as I said, access to medical countermeasures and pandemic preparedness and response, as well as my soft skills in terms of international negotiations. Then, as you mentioned, tech is like, it's become an inseparable part of our life now, of course, especially post-COVID, including in the health space. Because of the tech we had, the COVID-19 pandemic witnessed one of the fastest developing vaccines in the world. I mean, within less than a year, we had vaccines for COVID-19 available, and which was a breakthrough in itself. And that influenced the fact that there's a lot more which can be achieved in the future. Tech transfer involves the transfer of the technology from high-income countries to low-income countries so that low-income countries can manufacture their own vaccines as well. These concepts are being integrated much more into bilateral negotiations as well as multilateral negotiations across the world. The WHO pandemic agreement is one such example of how that is shaped. AI is another topic which has a strong influence on the legal industry as well as the healthcare industry. There's extensive use of AI robotics already in healthcare surgeries. There's extensive use of AI in research, extensive use of AI in diagnostics. All of this comes with a huge asterisk in context of things need to be regulated, both from an ethics perspective, as well as an IP perspective, as well as a privacy perspective. It's a complex ecosystem. It's solid emerging areas. You know how there was a phase on IP when every lawyer became an IP lawyer during the early 20s. I would say AI is like the hot topic these days when a lot of the lawyers and emerging lawyers want to enter into that space. On that, I would write an asterisk saying that please be deliberate about why you want to do AI regulation. Please be deliberate about why you want a career in AI, and just don't go with the wave itself. And yeah, that would be my 50 cents for there.
Thank you for being so clear about why you want to do something. These aspects are very important while you are deciding not only your career, but your life as well. And as you rightly said, everyone wants to enter AI field without realizing what exactly it is. Like you said, that while you were doing global health laws and you were pursuing that particular specialization that was pre-COVID, no one was interested. Now everyone else is interested without realizing whether it is there, why or not. On that particular note, you also engage in a lot of litigation in Delhi, especially related to health laws and other aspects. How do you choose which or what kind of cases do you want to see or go ahead with while you are working a lot for the society and trying to serve for the betterment of society, trying to understand the policies, how they should be made? How do you see those cases? Because every other case seems to be very, very important, but you cannot pick up all of them. So what kind of thought process goes in your mind when you are picking some cases on national and international basis both? And while you are litigating, that is love of your life in terms of law, I would say. So we would request you to talk a little bit about that decision of yours. How and why you choose any of your cases, and how do you look forward to making global health laws more talked about in India, especially?
So, first sort of clarification, I don't do a lot of litigation anymore. That is not my everyday life. I spend almost 80 to 90% of my professional life working on international policy, international research, international advisory work. The remaining space, I do spend a lot of time in litigation as well as advisory work. I wouldn't say litigation is the love of a life. It was my first love. And so, since the baggage of the first love always carries with you, that's what's happening with litigation right now. I pursue litigation, whatever litter I do, more out of passion and principle rather than, I would say, a professional obligation. And I do so because first, it was my grounding training. That's where I began my legal career in. And second, because I feel the most direct impact of law is witnessed in a courtroom and litigation itself. And then spending whatever little time I can in litigation helps me to hone and continue testing my analytical and reasoning abilities, which considerably helps me into being a better lawyer in the international space. And it also helps me understanding the domestic context much more because the domestic problems, domestic societal problems are witnessed in a courtroom at the end of the day. So I would not want to disconnect myself from the on ground domestic issues. And that's where litigation and advisory work comes in. I do have a law office in Delhi, which I manage with two more colleagues of mine. Both of them, thankfully, are into full-time litigation, so I don't have to worry much about it. I am very selective about my time in litigation. I take up cases very selectively. A lot of them are on issues of healthcare, issues about doctors. A lot of them are issues on IP litigation, IP advisory work, medical negligence, of course, healthcare regulation. A lot of them are supporting startups. I love working with startups. They are a crazy lot of people who are doing dynamic stuff, trying to solve problems. They have a very short timeline in doing so because of funding issues. So it's always fun helping them figure out problems. And you also enter into some of the business aspects of doing things. So that's my small litigation life I have. I would love to do more in context of working with healthcare institutions, healthcare startups, working a lot more into solid PIL spaces, which I try and do whenever I can. But then right now, the love of my life is international policy and international relations. And I think that's what I enjoy doing, still sticking with my first love to whenever I can. So yeah.
With the baggage of first love, you are moving forward to the next one with international law. This is considered very, very different, I would say. International law is something which usually students are told that study, but how will you practice? No one knows most of the time. You have extensively worked with Indian and international organizations at the same time. How do you see their professional culture, the way they decide or their decision-making process, and especially work ethics? Because this is something which differentiates everyone in every country you work, developed or developing, work ethics is something which takes you places. And how have you seen your work ethics different from your own space than when you are working with international organizations? What kind of thought process they have? The kind of decisions that they make or that you make while you are developing policies, drafting them for countries, difference between jurisdictions. Again, I will say the culture that helps us build our laws. How have you seen them different in several countries that you have worked with, the kind of organizations that you have seen? And how do you see that those ethics have helped them grow in a different manner?
That's a very fascinating question. I'll just first address the first sentence you said, which is about like how difficult students perceive entering international law is during law school. And I think since this interaction is meant for students, I think it's important to address that itself. I think that sentence has substantially changed pre and post COVID. Post COVID, working in international space has become much more easier because of adaptability of technology. The entire concept of doing remote internships and virtual internships never existed pre-COVID to an extent it exists now. There was always a financial struggle we as students have had during law school to try to get adequate international exposure, including international moots. So since that has considerably changed, I would say students need to keep that in mind and be positive about the fact that they have much more international opportunities, even in context of internships and RAships during law school, to find opportunities across the world, which they can do from their home country itself. Fantastic if they get the opportunity to travel and experience that in person, but it's absolutely fine if you don't. So that's my 50 cents on that particular sentence. In context of work culture and ethics, I think, as you rightly mentioned, it differentiates substantially across first different sectors, second in different countries, even within countries, multiple sectors. But if you're working in an international law space, you need to, as I mentioned, somewhere in the middle, understand the different work cultures and ethics of different organizations and different entities, because if you don't, then you won't be able to speak their languages. But while you do that, I would say it's advisable that one should have their own work ethics and work principles understood very well. You should have that written somewhere. I mean, you're reminded about who you are and what your work ethics are, what you would compromise and what you would not compromise at all. And if you maintain that, then you will find people who respect that, at least in the international space. I would say one important differentiation has been in the exercise of ownership, that in the international space, you are given much more of that than the domestic space. Then, as I mentioned earlier as well, spirit of collaboration is much more present in the international space than in the domestic space. People are much more open to collaborating within different specializations. People are much more open to collaborating with different governance structures and governance level. And we've realized that in international space, you cannot achieve the intended results without the level of collaborations required. Litigation, on the other hand, doesn't really require a significant amount of collaboration. You can be a one-man army if you want to. So that's a different level of interest as well as skill set that's required in both these spaces. Even the academic space domestically and internationally is very different. And I would, again, I'm saying all of this with the caveat that a lot of the work culture and the work ethics in India is changing and evolving as we speak. And it has changed over the last 5 years, which is fantastic. But a lot of the international academic space also involves looking at academics closely in relation to international policy and research. A lot of the centers at the international universities are much more dynamic in their non-academic work than I would say in India, which is where a huge gap lies. In India, most of the flourishing centers and policy think tanks are based out of universities and not in universities. That limits the kind of exposure you get, and that limits the kind of interaction between the academic and the non-academic world. And at the end of the day, students also suffer because they don't get the opportunity to as easily do RAs and internships as they would. Some universities are changing that domestically. I would not name them. But at the end of the day, universities are evolving. But then each university has their own bureaucracy. They have their own priorities. Each professor comes with their own understanding of different principles in life, as well as their academic goals. Just to wrap up the entire conversation on ethics and principles, there's no one formula or there's no one size fit all answer over here as well. And in order to be respected in any profession and in your work culture, you need to have your own work ethos clearly set. And once you have that, I think you'll be much more comfortable in expressing that to your superiors as well as your juniors in the process.
Wow, thank you for answering all these questions rather in this conversation so beautifully and talking about one size does not fit all. Definitely, one ethics won't fit everyone, but the aspects that you have brought in, they are very, very different from what we hear through academicians and researchers. The kind of aspects that you brought in today, for me, they are absolutely not only eye-opener, but mind-blowing as well. It is a beautiful conversation that I have had today. And thanks for doing something which is absolute niche in their own field. And you started way before COVID. It's just as commendable as anybody can think. And thanks, Kashish, once again for giving us this much time and being with us here and answering all the questions that we have had so candidly and openly. And it has been very, very, very informative for me and for my team.
Thank you. Thank you. Thank you so much, Divya. It's been a pleasure. Thank you for having me. I hope you guys continue with such conversations because one of the reasons to be very candid, I agreed on this conversation is because when I was a student in law school, and again, I don't come from NLU, I had very few mentors in the entire process. And I had very few people, especially people who would be in their mid-career phases, who would guide me. In fact, when I was applying for an LLM, I barely knew how to go about a lot of this stuff. And every year I end up taking a couple of mentees in the entire process. But then everyone has limited time. And so I hope such videos help a lot of the students understand different worlds and then find their own journey. So thank you for having me.
Thank you for this because it's not easy to find people who actually want to mentor. Although we all look forward to having mentors, but like you said, there is not much time with every professional. But it's really humble of you to be here and to give us this much time and to let learners know about your journey and the way you have built your own career in a very different niche of global health law. Thanks once again, Kashish. Thank you so much.
Thanks, Divya. Thanks, Anshi.